Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Women. Now, what are the signs and symptoms of dysmenorrhea? Here, especially if you're suffering from dysmenorrhea, do evaluate the type of pain while we are discussing in this video. Here in this video, we will be discussing about primary and secondary dysmenorrhea. So, first we will be discussing about the primary one. Location. See, the primary dysmenorrhea is located in the hypogastric region. It can have extension to the thighs as well as to your back. Okay. Secondary dysmenorrhea, what is the location? Usually, secondary dysmenorrhea also will have the same location, that is the lower hypogastric region. It can extend into the thighs or into the back, but certain section of people it can extend even down and it can be a little bit more painful. The extension can be a little bit further down, and also they can have this lower bearing down sensation as well, that is something is being pulled out from the uterus. This sensation can also be present, but usually the location is same for primary as well as for secondary dysmenorrhea. You cannot differentiate based on pain. Timings. You can differentiate primary and secondary dysmenorrhea based on pain timings. Remember that the primary one, which is very common, occurs 1 day or 2 days before the actual menstruation. Okay. And then it peaks during the first day, that is the first 24 hours of menstruation. And then it can stay up till the second and the third day, and it will slowly subside. As soon as you finish off your menstruation, the pain also will subside and there will be absolutely no pain after menstruation. This is primary dysmenorrhea. Then secondary dysmenorrhea timings are very important. The secondary dysmenorrhea, the pain will start a week or 6 days, 7 days before menstruation. For some people, they can experience high intensity pain. For some people, it will be very low, dull, aching pain. It can start anywhere between 3 days before to 1 week before the actual menstruation. It can be high or low, but there will be continuous pain. And then after that, during the menstruation, the pain will be severe and it will continue even after menstruation. There can be dull pain, there can be intense pain, okay? But it will continue, during the menstruation and after the menstruation also. This is the characteristic feature. In some people, the pain will increase as the flow increases, okay? The pain will start to increase as the flow increases in secondary menstruation. In primary menstruation, the pain will peak in the first 24 hours and it will slowly start subsiding on the second and the third day. Scale should go down. But in the secondary menstruation, the pain will go high during the menstruation. It can be maintained or it can decline, but the pain will still be there even after menstruation. That's a characteristic feature. Intensity, as I told you, primary will peak in the first 24 hours or in the second or the third day and it should subside. But the secondary one, the peak can be anywhere between the first week before the menstruation or during the menstruation, and it can also continue as well. Changes in pain pattern. If you are someone who is experiencing pain during menstruation, so what you should note, the first thing you should note is if there is any change in the pain pattern. That is, if you are someone who is experiencing pain during menstruation and the pain is slowly starting to continue even after menstruation, or the pain has increased, that means the threshold for pain, if for example, if 5 is the pain scale and you're experiencing 2 in the pain scale radar, but now you feel that the pain has increased a lot and there are a lot of clots or there is irregular menstruation, any change in pain pattern, any change in your menstruation pattern, do get a doctor consultation as soon as possible. Next one is pain outside the menstruation, which I already mentioned, that the pain will continue even after the menstruation in secondary dysmenorrhea. See, as I told you, the pain will continue after menstruation. It is not, compulsory for every person who is suffering from inert problem to have this pain. Where you should differentiate is that if there is any pain pattern change, first thing. Second thing, any pattern change in your menstruation, you have to differentiate. And also, if there is any other associated, symptom along with it, that is irregular period or there is no period at all for 2 to 3 months, any changes in the normalcy should be evaluated by a doctor. Okay, then what are the other signs and symptoms? In primary menstruation, some people can experience PMS, okay, where there will be nausea, vomiting before 1 or 2 days before the menses, and it can continue during also. Some people will experience diarrhea, some people will experience headache, fatigue, dizziness, breast tenderness as well. These symptoms can also be in the secondary dysmenorrhea. So these are the common symptoms of primary as well as secondary dysmenorrhea. So what are the differences in the primary and secondary dysmenorrhea? So what are the other signs and symptoms that you should be looking for is that abnormal uterine bleeding. That is, if you're experiencing a lot of period, that is prolonged period or diminished period or period in between the periods, that period frequency has increased, anything which is abnormal, dyspareunia, that is if you are married, painful coition or painful intercourse, and vaginal discharge if it is mucoid in nature or if it is sticky in nature, if it is offensive in nature, if the color has changed, any of these symptoms, any of the systemic symptoms like nausea, vomiting, headache can also be there in secondary dysmenorrhea, as we already mentioned. Infertility. Some people might be trying to get conceived, but they are not conceiving, and there is pain radar increasing, and there are other symptoms associated with it. Please do take a doctor consultation as soon as possible. Other symptoms like, if there is any bleeding or pain while defecating, or if there is any pain while urinating as well. See, there are certain conditions called as endometriosis. These are the symptoms like pain in the rectal region while passing or defecating, or pain in the urinary bladder while passing urine is also present. If you're having any of these features as well, please do get a doctor consultation as soon as possible. If you're someone who is experiencing pain during every menstruation and you want to decrease it, that is primary dysmenorrhea. And if you're someone who is experiencing pain along with other abnormalities in your flow, that is secondary dysmenorrhea, and you would like to get in contact with us, we have two kinds of consultation options. One is the online consultation, the second one is the offline consultation. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you're someone who is staying far away from us, you can contact us online. We have two options, that is audio consultation as well as video consultation. After the audio and video consultation, if we think you are suffering from secondary dysmenorrhea, we will ask you for investigations, or if you have already done investigations, you can send it to us. And after the doctor consultation and after the whole process is done, your medicines will be delivered to your doorstep. That is, home delivery option is available, where if you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And if you're staying anywhere else, it can take 4 to 8 business days for our medicine to reach your doorstep. If you want to consult us, you can call us on this number. You can WhatsApp us, you can message us, or you can call us. If you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. So if you're someone who is experiencing painful menstruation and you do not know what kind of painful menstruation it is, that is primary or secondary, or if you're someone who is experiencing pain in every menstruation and you would like to get rid of the pain to have a better work-life balance, or if you're someone who is experiencing pain along with the abnormalities, that is female reproductive problems, you can contact us. And also, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we have three principles. One is the highest success rate. See, we are already experiencing a rush of patients who are approaching us for different female reproductive problems, and the success rate is really high. It is good. And also, there is transparency in treatment. That is, that there is no gray area between the patient and the doctor. Any sort of prognosis that you should be knowing, we will be letting you know. And also the personal care here at Fidicus. If you have any sort of myths, or if you have any sort of queries regarding your own problem, we will be educating you. And not only that, we will educate you in all aspects of your problem. So if you want to choose cure, if you want to choose a better life, choose Fidicus Homeopathy. Thank you.